Thank you, Senator Catherine Muma. A round of applause to the session chair that has just left the stage. Right Honorable Speaker, my colleague senators, led by the leadership of the House, distinguished guests, ladies and gentlemen. Good morning. We are going straight into the first session, the second session, where we will be discussing implementation of the universal health coverage. My name is Senator Sifuna, Senator for Nairobi County, and the Deputy Minority Whip in the Senate. As you are aware, as a House in 2023, we passed 3 critical bills that were intended to implement universal health coverage. And the promise of universal health coverage was that all Kenyans would access essential health services without suffering financial hardship. That last bit is very important to all of us. And I remember during debate one time in the House, the senator from Busia, Senator Mtata, had to come to my rescue on the definition of universal health coverage. However, since its rollout, a number of issues have emerged that have hindered its full implementation. Article 43 of the Constitution provides that every person has the right to the highest attainable standard of health. Under the Constitution, the national government is mandated to formulate health policy, regulate, and most importantly, provides that every person has the right to the highest attainable standard of health. Under the Constitution, the national government is mandated to formulate health policy, regulate, and most importantly, provide technical support to county governments. We will be seeking to understand if indeed all Kenyans have access to quality, affordable, and comprehensive health care. We also hope to unpack the challenges facing the Social Health Authority, paying attention to the county governments, and to provide solutions for the challenges identified. To take us through this session is the presenter who needs no introduction, invitation to a fight on things that lives. Honorable CS is here, Cabinet Secretary in the Ministry of Health, the Honorable Duale. Honorable Duale is a seasoned politician, a member of Parliament, Dugis, and led the Garissa Town constituency. Having served as a member of Parliament for Dugis and later Garissa Town constituency from 2007 to the year 2022. It is worth noting that Honorable Duale was the first majority leader in the National Assembly, where he served for 8 years during the 11th and 12th parliaments. He also served as a member of the House Business Committee. Before being appointed to the current position, Honorable Duale served as a Cabinet Secretary in the Ministry of Environment, Climate Change and Forestry between 2024 to 2025. He also previously served as Cabinet Secretary in the Ministry of Defense from 2022 to 2024. In 2023, Honorable Duale launched his memoir titled For the Record, Inside Story of Power, Politics, Lawmaking and Leadership in Kenya, which I invite all of you to read. It has very intriguing insights. The book, which was inspired by his own political Duale has been involved in high-profile government initiatives such as the transition from the National Hospital Insurance Fund to the Social Health Authority, and during his tenure as Cabinet Secretary for Environment, Climate Change and Forestry, implementation of the 3rd National Climate Change Action Plan, including launching the National Framework for Climate Services. Honorable Duale has continuously reaffirmed the importance of healthcare, that healthcare remains one of the key pillars in the government, and has committed to achieving universal health coverage, including championing for full implementation of the Social Health Authority with the aim of expanding access to affordable and quality healthcare for all Kenyans. Now, without further ado, I want us to give a round of applause to CS Duale to make his remarks. CS, we have started late and we apologize for that. So the advice from the leadership is that you will present for 30 minutes. And then because this issue of healthcare is so critical, especially to us as a Senate, our colleagues in consultation with the leadership of the House have proposed that instead of having two discussants, one of which I'm told is coming on the way, the Honorable Governor for Mombasa County, Mheshimiwa Abdul Swamad, that we just go straight to plenary. So, because you are not one to be afraid of any questions from the senators, they want to engage you briefly, Honorable CS, in a short plenary session on the issues that you will have raised in your speech. Karibu sana, Mheshimiwa Duale.
Honorable Speaker of the Senate, the Right Honorable Amason Jeffa Kingi, EGH MP, the Honorable Senator Aaron Cheriot, Senate Majority Leader, the Honorable Justice Retired Stuart Madzayo, Senate Minority Leader, and the entire leadership of the Senate, Senator Jackson Mandago, the Chairperson of the Senate Standing Committee on Health, Honorable Senators, the Clerk of the Senate, and the entire staff of the Senate, ladies and gentlemen, good morning. Honorable Session Chair, I will both have my speech and my team will also project the presentation on the screens so that members can follow the numbers. Honorable Speaker and Honorable Senators, it's a very distinct honor to stand before you this August House today, and the journey to transform Kenya's healthcare system has been long and hard, but it's a journey we have to walk together. The Senate stands as the absolute guardian of devolution mandated by Article 96 of the Constitution in order to protect the interest of our counties and governments. And because healthcare is a devolved function, your legislative wisdom, oversight, and bipartisan support are the bedrock of the milestone we will celebrate today. Honorable Speaker and Senators, before I report on our progress, let me address a foundational truth that devolution of health was not a mistake. It was a profound constitutional milestone and one of the greatest equalizers in our nation's history. And that's why today, because of devolution, we have functional level 4 and level 5 hospitals across all our 47 counties, delivering life-saving interventions closer to the people. When this administration took office, we anchored our mandate on the bottom-up economic transformation agenda, and to realize this vision, Parliament undertook a historic legislative marathon, enacting 4 critical laws that form the legal spine of our healthcare system. The first one was the Social Health Insurance Funds Act of 2023, which established the Social Health Authority to replace the National Health Insurance Fund. The second one is the Digital Health Act of 2023, creating the Digital Superhighway for health data. The third one was the Primary Health Care Act of 2023, which operationalized the hub and the spoke model and the community health promoters. And the fourth one, and very, very important, which I'll speak to, and I'll need the support of the Senate is the Facility Improvement Financing Act of 2023, which was ensuring funds raised in hospitals and health centers and in healthcare facilities stay and remain in hospitals. Honorable Speaker and Senators, let us be very honest about where we came from. Prior to the reforms, our system was ailing. We had a very fragmented financing model where NHIF paid out more in fraudulent claims than it collected in legitimate premiums. We had no visibility of data of the patient records, and our patient records were paper-based, making portability impossible. When I first stood before the ministry staff during my maiden speech on 1st of April 2025, the situation was critical. We were 6 months into the rollout of Taifa Care. We were facing public scrutiny, systemic roadblocks, and that time I told the country that I will be a bulldozer for the right reasons. And I was to clear the way for UHC, to crush the bureaucracy, and to build a system that works. Today I return to a very important institution, the Senate, the custodian of devolution, to report on how that ground has been cleared, what we are building upon it across the 4 core pillars of the universal health coverage. Honorable Chair, I forgot, let me just introduce in 1 minute that I came with 4 critical officers. I've come with my PS, Dr. Oluga Ouma, come with the Director General of Health, Dr. Patrick Amoth, come with the CEO of SHA, Dr. Masi Mwangangi, and the CEO of DHA, Engineer Anthony, among other staff of the ministry. They will help me in answer many of the questions. So when the question time comes, I'll allow you that they come and sit here. Honorable Chair, the first pillar was sustainable health financing. The transition from NHIF to the Social Health Authority is the engine of our reform. As of 26 February 2026, we have registered 29.7 million Kenyans. We have collected 142.7 billion shillings in contribution, and we have successfully disbursed 105 billion to healthcare providers. We have stabilized the system. We are achieving an average claims settlement rate across all the providers, be it private, public, and faith-based, at a settlement rate of 73% across the board. However, Honorable Speaker and Senators, we must confront the narrative of the alleged loss of the Kenya shillings 11 billion. And today I want to set the record straight, Honorable Senators. And I want to wish to categorically state, looking at you in the eyes, that there have been no loss of 11 billion from the Social Health Authority. This figure, which currently in fact has grown, currently stands at 12.7 billion as of today, represents the claims that were flagged, the claims that we rejected, and the claims that were unpaid by our digital superhighway gatekeeper. So these are money that we have saved. These are money that if NHIF was in place today and was using the manual system, this money could have been paid to providers. And I'm ready to give this 12.7 billion that we have rejected, that we have unpaid for, that we said we will not pay because of number of reasons, because of fraud. I'll give you a data showing how many of that 12.7 billion is from the private health providers, how many we have rejected from the county public health facilities, how many are from the faith-based, And how many are from our own hospital, referral hospital, including Kenyatta and MTRH? So no money has been lost, but we have saved money that were to be paid by the Social Health Authority. And we will give the reasons why we rejected them. A key component of this financing, therefore, this represents money saved, not money lost. A key component of this financing model, Honorable Speaker and Senators, is the realization of the primary health care. We are currently rolling out a service charter